Hey guys, if you're new here, this is Dr. JT, General Medicine Resident and a part-time YouTuber, and I welcome you to my channel, Dr. JTM. And by the way, did you subscribe to my channel? If not, do subscribe it now and also click that bell icon, because in our video today about the career guidance, the branch we are going to talk about is the strongest and the branch that many people will feel stylish, cool and passionate, and that is orthopedics. And we have a real special guest to talk about this branch, orthopedics, in which he'll be talking about the pros, cons of taking orthopedics and how will be the life and future in orthopedics. And we also have a fun round where we'll be putting all the teasing questions for these orthopedicians. So don't miss, watch till the end, and with no delay, let's begin the career guidance video of orthopedics.
Orthopedics, branch that made me feel strong and gave me confidence to make people strong physically. I started my journey when I was 17, did my MBBS from Kasturba Medical College, Mangalore, post-graduation from JJM Medical College, Davangere, and I did my fellowship in joint replacement and also in trauma. This is me, Dr.Satya KODURU.
Hello sir, welcome to my channel Dr. JTM, and I'm very happy to have you in my channel regarding this particular video, that is career guidance to PG aspirants, guiding students into this your stunning branch orthopedics. And I have a lot of questions for you to ask about regarding why this branch to how this branch will be for PG aspirants, and I think you are all set to answer all of them.
Yes, of course. Hi viewers, I am ready to answer whatever doubts you have or whatever he is going to ask me. Yes.
And I think let's start the first round, sir.
Yes.
Yes. So the first round is about the importance of branch. So sir, the first question, why orthopedics? What interesting point that you have seen in that branch?
In the year, I think 1989, when I was posted in Government Venlock Hospital in Mangalore, Kasturba Medical College in orthopedic department, I used to see lots of patients coming down wheelchair or with the support of somebody. They never used to walk on their own. At the end of the posting, when we finished our posting and when we were going back after 1 month of undergraduate posting, we saw all of them getting up and walking on their own and going home. So that made me impressed with the branch. That's how I thought, I wanted to do something like this in my future, if at all, if I want to do some post-graduation.
Wow, that's one good initiative point that you have taken to enter into this branch. Did you actually have orthopedics as your primary choice, or you had 2 to 3 surgical options as surgical branches as options, or you took this orthopedics just because no other option is there?
That was the only branch which I decided in my second year MBBS.
Wow, that's really great, sir. So in the second year itself, you have come to know that orthopedics is your branch. So the next question I want to ask you is, where exactly this orthopedics stands in the world and also in India?
It is always in the top 5, I can say, because road traffic accidents, high-speed vehicles, and very good roads, what every country has, and even bad roads in Indian scenario. All these things, make everybody fall into some sort of accidental issues, and getting into fractures and all those things are very common in these things. And also becoming old, having osteoporotic bones, arthritic joints, all these things will always have an orthopedic surgeon into their life. And definitely orthopedics is an evergreen branch, and I think choosing orthopedics will be definitely life-turning for any candidate.
If that is true, sir, with that question I want to ask, how are the standards different in other countries like US, UK and Australia and in India with respect to this orthopedics branch?
When we were the student of orthopedics back in 1994 to 97, we were slowly getting introduced to all the latest techniques and technologies to India. And right now, whatever US or UK or Australia, New Zealand is performing, in the next week we are doing it here. So I don't think we are any less to those people.
So that means we can clearly give a message to people who are thinking that they need to pursue orthopedics in any other country is no different, and every other advancement is here.
Yes.
And they can practice orthopedics here.
Exactly.
So sir, with that question I want to move on and ask about, tell the students the importance of orthopedics and why they need to take orthopedics.
Now, for anything, you need to have passion to select a subject. First of all, if you don't have passion, and if you try to get into the system, it is very difficult for you people to get into the streamline and work hard or to follow the protocols of the department. It's very difficult. So first of all, you should have a clear cut thought whether you want to get into surgical branches or medical branches. If you want to get into medical branches, you need to know whether you're going to do super specialty or not, or you want to go for an end branch like psychiatry or dermatology. If you want to get into surgical branches, you need to have a clear thought again whether to get into end branch or a super specialty. So depending upon that, you choose and then you decide where exactly you want to go.
And sir, then kindly tell us what will be the top 5 colleges, top 5 government colleges in India.
Bangalore Medical College is number 1 according to me in South India, and there is definitely Davanagere JMMC, which is though private, it is attached to the government hospital, and the entire work what you do is in the government hospital, and enormous amount of workload you have, and it's very difficult to sleep at least for 72 hours if you are on duty. Every college in Mumbai, especially owned by government or government run medical colleges, are fantastic for orthopedics, and Safdarjung in New Delhi is very good, and then of course AIMS, as you all know.
So those will be the 5 top government colleges. What are the top 5 deemed or private colleges that are good for orthopedics in India?
I would prefer Ramchandra in Chennai, and then you have Vaidehi in Bangalore, and then D.Y. Patil in Mumbai, and even in Pune. Both of them are very good.
So these are the list of 5 important colleges for deemed and private, and also sir told 5 top colleges, top government colleges. And if you want to go for counseling and you want to opt orthopedics, make these colleges into your list. With that, we have ended the first segment, and that is really very good for us to know a lot of things about sir and also about the branch. And we'll be moving on to the second segment, which is particularly about the life of a PG student when they opt for orthopedics. So we are into the second segment, that is about how life of a PG student will be in orthopedics. So sir, the first question will be, how about the workload in orthopedics branch when compared to a government college and also a private college?
See, it all depends upon which private medical college a candidate gets into. So in Karnataka, almost all private colleges are at par with government colleges, and in Andhra, especially NRI Medical College is almost at par with government medical colleges in the workload, especially when it comes to PGs. Definitely, work of a postgraduate is impossible to describe because they have lots of work to do. They have so many things. Their work life starts at 7:30 a.m. in the morning and it goes on and on and on.
This is one of the orthopedics is one of the best surgical branch. So in view of that, what should be the approach of a PG student, like after entering into the orthopedics, if they want to balance the surgical skill learning aspect and also the theory part, how do they have to balance?
What I wanted to emphasize here is, first of all, a candidate getting into orthopedics should have that interest, that zeal in him or her. Once, if they have that zeal, follow the curriculum set by the Department of Orthopedics. They will have exposure to the theory part first, basics, then surgical and hands-on experience. By the end of first year, definitely they will be able to, confidently they will be able to operate at least 5 cases on their own without anybody's help.
Sir, that point leads to me asking you about this stress level the PGs actually face, like the mental health being very important these days. Yes. What is your comment on that, sir?
See, if you do your work properly, I don't think anybody will be stressed. See, it all depends upon individual personality. That stress levels will be taken up by the candidate or not cannot be decided by the branch, I feel. It all depends upon an individual personality, the way he is brought up by the parents and the environment and his friends and his college, and all those things makes a lot of difference. It is an individual perception. In case if they want to get stressed, there are people, I still remember 1 or 2 PGs, in the year 2016, they used to get stressed out like anything for small reasons also, but thorough counseling with them. I had to sit with them for about 2 hours a day, and then I convinced him. After 1 month of that, there was entirely a different candidate coming out of that stress level.
Wow, sir. With this thing, I just feel like clapping, sir, because any PG who is entering into any branch will have a lot of stress. That is obvious. But you need to talk to your mentors or professors. You might have that fear, but feel free to talk at least once when you have that total stressful mind with the work. The work and family life. Balancing both the professional and personal life is also very important.
That's right.
So how do they have to balance both of them?
Once you're done with your post-graduation and then get into marital life is what my suggestion now. In case if you're already married and you want to so you have to keep your family life to a side if you're working in a government setup or in a private medical college like, NRA, you have to keep your family to a side because first preference needs to be your department. So you are married to the department where you join, and then comes your real wife actually. So what I feel is balancing during at least first 2 years of post-graduation is very, very difficult. If at all, if you want to get married during your post-graduation, if that is your goal, I think I prefer first half of the second year.
Okay, sir. So the next question will be, is orthopedics an end branch, or do people can take any fellowships, or they can go into another country for fellowships, or they can work in the corporate sector, or they can put up their own setup outside?
Sincerely speaking, it is not an end branch now. When we were studying, it was an end branch. But recently, there are so many subspecialties. As I said earlier, we have pediatric orthopedics, who are interested in doing pediatric orthopedics and pediatric trauma. Then to do congenital deformities, you can get into pediatric orthopedics. Then you have spinal issues where you want to do spinal fixations, scoliosis corrections, all those things. Then you have arthroscopy and sports medicine specialists where you do only scopy work, keyhole surgeries. You have arthroplasty where you get into joint replacements like total knee joint replacement, hip joint replacement, shoulder joint replacement. Then you have trauma, orthopedic trauma, which deals with all the fractures. Along with that, you have hand surgery, which is very upcoming and very challenging subspecialty. And at the end, orthobiologics, especially the regenerative orthopedics, is the in thing right now, and it is coming up like a bullet train now. So you have many options. What I sincerely suggest for the people who are coming out after passing out of MS Orthopedics is to get trained at least 3 years before starting your own office. So get more experienced, more exposure to all these things. If at all, if you want to get into one particular branch, focus that and train yourself perfectly in that area, and then go and start. A rural practitioner, maybe 1 or 2 years of general trauma is very, very important. You need to learn the general trauma, basic fracture fixations, and you can straight away go start in a rural setup, but not in a city or suburbs.
So these are the very crucial points that you need to know. Just completing MS Orthopedics is not that it. There are a lot of options that you need to look into afterwards, because in this competing world you need to develop any other skill other than being just MS Orthopedics. And also you need to have that thing, like whether you want to practice in the rural or urban, have these points that sir told us. Sir, the next question is quite interesting. Like, many people thinking that orthopedics is just for men. Girls also want to opt it, but many were telling that they're creating a taboo that they need to have strength, they need to be bold. What about this, sir?
I wouldn't agree with that, because when I talked about the subspecialties, when you have pediatric orthopedics, I think girls are the better people to deal with pediatric cases than men. Okay, when it comes to arthroscopy, which needs at least 40-45 minutes or 1 hour of your time, and you don't need anything other than a nice skill of your hands, where again your girls can come into the picture. Previously, when our teachers were doing orthopedics, yes, what you said was correct, the strength was the main. But after introduction of so many electric based surgical tables and tractions given by all these machines, I don't think anybody needs that much of strength. You can use your brain and then practice in orthopedics.
Wow, sir. So this is a direct, straight point for all the girls who want to opt orthopedics. Just don't give any second thought. If you are really interested, just go for it. There are a lot of options even after completing your orthopedics. So with that, we have completed the second segment. All the professional questions and all the doubts have clarified for you, because everything from right from A to Z was explained and told by sir. And with that, we have ended second segment, and we have third segment, which is completely some teasing questions that I'll be putting to these orthopedicians. So watch it and we'll start it. So we are into the third segment that, as I said, I'll be providing some entertainment, asking these orthopedicians with some teasing questions. So sir, the first question is, tell us about the craze of an orthopedics PG, particularly among the interns and among the relatives and among the family. Like, I have heard these orthopedics PGs are quite flirty type. What do you say?
Yeah, back in 1994 to 97, when I was doing my post-graduation, people used to run after orthopedic PGs. I think the same thing happened even when I was professor of orthopedics in Pinamaneni Siddhartha Medical College, and after that I came to NRI in the year 2014. Even there, I started seeing a different version, because orthopedic PG started running after the girls. I don't know, it suddenly changed. Maybe they lost their importance. I'm not sure about it.
Okay, sir. So, sir, the next question would be the much wanted question I want to say, because we want to know on a par how much will an orthopedician earn per month.
See, if you are stuck to a medical school and in a private setup, especially in Andhra, maybe very, it's peanuts, I can say. Very less is what they paid. And when you go into a corporate setup where you want to start your career as a registrar or senior resident, a decent pay of 100,000 Indian rupees is paid, is what I believe. And for an experienced man, at least with 5 years experience as a job holder, he can draw around 250,000 Indian rupees per month. But if you have your own setup and if you click, I don't think you need to have a counting mission to count the money.
So, sir, that means you're saying if they are thinking after immediate completion of orthopedics, they'll get a lot of money, then that will be a misconception.
Yes, that's
okay, right. So that is the point. Just don't think that after completing this MS, I just earn a lot of money. No branch will earn. So, sir, tell us about this matchmaking. That means with an orthopedics PG, what other branch PG could be exact match for marriage?
If you want to balance, I want to tell about life and work-life balance here, because if you want to have your kids with one of the parent, your orthopedics should have a dermatology or non-emergency or non-surgical branch would be an ideal, and a deadly combination would be orthopedics and gynec, because both of them run around the hospitals and patients, and you got to leave your kids or your parents or your family to somebody else. You need to always think about, even if you are into surgery, then you have to think about what your kid is doing and blah blah blah, all those things. So it is always better to have non-emergency attending branches like ophthalmology, ENT or dermatology.
Okay, so that is really a good point. As sir said, it's up to you, but these points you have to put in mind. Sir, tell us about who is your friendly department in the hospital.
I am friendly to each and every department, including housekeeping department. So there is nothing like I have a favorite department in the hospital. But I like every candidate, every faculty, every staff, every PG, every intern, if they are really doing something good to the society and the patients.
Sir, then let me put this question. Who is your enemy department? Like, you don't have much rapport, you always have that conflicts.
See, generally, not to me personally, generally to an orthopedic surgeon, it is anesthesia. But not to me personally, because I try to be friendly with everybody, because I want my work to be done. So I usually play a safe game.
That's also a good point. So anesthesia and orthopedics I don't know what happened. So, sir, tell us what is the best compliment that you have got from a patient that you treated?
I still remember one patient who came down from Chhattisgarh, say about in the year I think 2014. She came literally lying in the car, in the back seat, suggested by somebody from AP. So she came all the way. Her husband drove her down here, and after admitting her in NRA and after treating them, they went back smiling, walking and whatnot. Everything she has done in front of me. It was the gratitude what they showed me was just both of them fell on my feet and they just thanked me.
PGs who wants to take orthopedics, and this is an inspirational point for you. Gratitude of a patient actually gives you a lot of excitement. So don't give up on your favorite branch, that is orthopedics, if you are aiming for that. So that's all for today. I think every one of you have got your doubts and a lot of questions are answered regarding orthopedics. So if you are ready to choose orthopedics, then every point that is said by Dr. Satya sir is very, very important. Take them down and choose a right college at right time, and all the very best. And I'll be back with another great video and another career guidance subject. And sir, anything to our subscribers?
Yeah, please do subscribe to Jeswar, and whatever comments you have, you can put it on the video.
Thank you, sir. Thank you so much for coming to our channel and guiding the PG aspirants. We are really happy to have you. Thank you so much, sir. And so that's it. I'll be back with another great video. If you have any comments, do comment down. Thank you. Bye. Take care.